My name is Dr. Sujit Vasudevan. I'm a consultant physician in Cochin, Kerala, and I have been practicing for about 42 years. I thought I'll spend a little time with you in sharing my ideas about COVID 19. I know this is a topic which has been flogged to death over the last few months, but I would like to share a few points regarding what we should do, how our approach should be in the aftermath of the lockdown or after the lockdown has been removed. We've been one of the few countries which have removed the lockdown at a moment when our numbers were very high. And it is noted that the numbers have even been spiking since the lockdown was lifted in certain pockets, and I'm sure that over the ensuing weeks and months we are going to be seeing very many more numbers of COVID patients, many more deaths in vulnerable populations, and an increasing strain on the country and on the population and on us and our families. So the problem is that lockdown cannot be continuous. Lockdown can affect the economy, the health, the social structure, and the entire fabric of society. So we have to open up at some point or the other. Whether we did it at the correct time, I mean both the lockdown and the lifting of the lockdown, it's a debatable point. I will not go into that. But I will just share a few ideas about how I feel we should go back in trying to get back to normal activity. We must realize at the same time that there is probably never a return to what we knew as normal, say in November or December of 2019. Everything is going to be the new normal. Therefore, there are no hard and fast rules about these, because each business, each profession, each industry has its own strengths and weaknesses. And whatever we do to try and return to near normalcy will have to be individually tailored for each organization. There are certain points, however, which may be taken as common for all these. Time and again we have heard about the basic precautions to be taken. These precautions will have to be continued to be taken, whether it is hand washing or hand hygiene, whether it is wearing of masks, preferably 3-ply surgical masks, leaving N95 for the health workers and contacts, and cloth masks when 3-ply masks are not available. So use of these masks and proper use of these masks. We are as a race, or as citizens of India, we have certain amount of indiscipline which is enshrined or embedded in us. We tend to congregate, we tend to crowd, we tend to rush, we tend to elbow and push people around. We also fail to obey basic instincts. Like, for example, a mask is to protect you and others. And very often I have seen people leaving their nose open, wearing the mask on the chin, removing the mask or lowering the mask when you speak. So masks should be worn at all times, except maybe when you are at home, and it should be a proper fitting mask. And people should be advised in the office that they should wear their masks properly at all time, don't touch the mask, and so on and so forth. Respiratory hygiene is something which is also very important. When you cough, you should protect your other colleagues by using a tissue or a handkerchief, or using the inner aspect of your elbow. And all these tissues and cloths and handkerchiefs should be properly disposed of. Respiratory hygiene, hand hygiene, and physical distancing, also called social distancing, is something which should be at the core of every organization which is striving to come back to normalcy. A distance of 2 meters should be maintained. If you have a large crowded office, you should try to uncrowd it by reducing the number of people, making shift systems, trying to weed out vulnerable people, people who are above the age of 60 or 65, people who have pre-existing diseases like chronic respiratory illnesses, chronic heart disease, diabetes, people who have undergone treatment for cancer, people who are immunocompromised and suffer from other chronic diseases should be advised to stay at home and do what we call as reverse quarantine, or stay at home and not go out. So numbers should be the basic minimum. You should try to arrange safe transport for your employees as far as possible, because now public transport, the other day I saw in Cochin, buses are going almost full, and that is not a very safe thing to do. Inside the office, you should try to minimize person to person contact, especially face to face contact. This moving around desks, handing over papers should be brought down to a bare minimum. This can be ideally approached by going to the digital system using emails, WhatsApp, and a host of other new communicative models which have come to us, like Zoom, Teams, Connect, and so on and so forth. As far as possible, physical contact with customers and other individuals in the office should be avoided or brought to a bare minimum. The same goes for things like canteen and cafeterias, where maybe you should have a shift system where only a few number of people go at one time, try to sit at separate tables, finish as soon as possible and come back to your work sites. Similarly, the practice in many offices of supplying tea, coffee, etc. at the tables should be withdrawn, at least till things improve. Cleaning the premises is something which is very important. Before you open the office, you should get a professional body to come and disinfect your entire office through and through, every part of it, especially the bathrooms and other common areas should be thoroughly disinfected. Once you start working, areas like desktops, hand railings, staircase railings, door handles, door knobs should be disinfected on a regular basis, because these are very common sources of the virus to settle down. And then you touch it and you touch your face or your eyes or your mouth. Everyone touches their faces hundreds of times in a day unconsciously. So this is something that should be done. Another thing is elevator buttons. If you are on the first floor, try to avoid the elevator. But if you have to take an elevator, please see that you do not use your fingers to operate the elevator buttons. Carry a pen or some kind of a stick or a piece of a rolled up paper or something like that to operate the elevator buttons. In other words, try to avoid direct contact with surfaces, especially strange surfaces in office or the place where you travel. When you do so, you must practice hand hygiene. Offices should have wash stations with soap and water or alcohol rub and do this frequently, because it's very difficult to keep remembering to do this, but please try and do this very frequently, so that you try to keep yourself safe. I have suggested for some of the organizations and corporations that I am a doctor for, that they should appoint a very specific officer as a COVID officer, who will from time to time give directives, will be trained of course by medical officers or social workers on what are the things to do and what are the things not to do. And these people will be responsible for maintaining anti-COVID measures within your premises. These are some of the ideas which I wanted to share with you. I realize that these are only basic principles, and you have to modify them according to your organization, your needs. And I wish you all a very safe period ahead for the future, till we are out of this mess, till we are out of the pandemic. This is going to be with us for quite some time. It's very difficult to say when it's going to go away, but I wish you all the best, and please stay safe. Stay safe.